Welcome back. This is Dr. Jin Sung. Today's Tuesday at 12:30, and I'd like to thank everyone who's liked the page and shared it. Last week's video on anxiety, depression part 2 has gotten a lot of interest, so please share the videos, and let's get started today on dizziness. There are millions of people who experience some sorts or some level of dizziness in their lifetime. And there's many causes for dizziness. So there's a lot of questions to be asked when you want to find out about dizziness. What is going on with that patient, right? So things like, am I spinning or is the room spinning is an important question, right? Do you have the sensation that you're spinning around or is the room spinning around you? Makes a big difference. Am I falling to the left, to the right, forward, backwards, right? Those all matter. So if you look at different vestibular disorders, you have to look at it in terms of, is it a peripheral disorder, meaning outside of the central nervous system, or is it a central vestibular disorder, which is more of the brain, cerebellum, etc. Right? So there are many causes for dizziness, and today's more of an introduction, and next week, in the next 2 or 3 weeks, we're going to go into part 1, 2, and 3 of dizziness. What are the main causes and how do we help those patients? So now, number 1 is BPPV, right? This is when you have a little stone stuck in the hair cells and it causes dizziness with position, right? So you turn over too fast, you might feel dizzy, and then it'll go away and then it'll come back again. So that's one of the more common disorders for dizziness. There's something called vestibular neuronitis, that's more acute. There's Meniere's disease. There's cerebellar degeneration, or sometimes autoimmune attack on the cerebellum, part of the brain that calibrates this, the dizziness aspect of things. Blood sugar and blood pressure also plays a big factor in dizziness. Genetic disorders like Charcot-Marie tooth, and people who have peripheral neuropathy can also experience dizziness, because if they can't feel their feet, then they lose that proprioception into the cerebellum and the parietal lobe. So when you start to lose sensation in the lower extremity, then it starts to affect brain function over time. So we're going to go in depth into all these different conditions that may cause dizziness or vertigo, and then kind of dissect it in terms of what can we do as functional medicine practitioners or functional neurology practitioners to help these patients regain some of their ability to balance, right? So we're also going to look at some of the testing that we would do in our office. So a simple test like Romberg's, where you stand with your feet together and just stand there. Do we have swaying, movements, right? If you closed your eye, would you fall over to your left, to your right, or backwards? Right? These are all things that we need to look at. Is our hand movements coordinated? Right? Are we able to kind of do these types of movements with our hands? Can we do fine motor movements? These are all clues as to why you may experience dizziness, right? Eye movements. If you look at your eyes and you look at the tracking of your eyes, it can also give you a lot of information about where the dizziness might be coming from. The most important part of assessing a patient with dizziness is a thorough consultation and questionnaires that can help narrow things down to the area that is dysfunctioning. So it's very important to look at history, mechanisms, as well as an in-depth questionnaire that can decipher the areas that we need to check. All right, so tune in next week on the topic of dizziness and vertigo, and we're going to go in depth into how we can help those patients. Okay, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side.